mode.
Okay, hi everybody. Here we are this afternoon to talk about tips on treating trauma and old injuries. You know, I was looking through some notes that I had collected for a class that I used to teach on pain management, and I thought, you know, some of the stuff in here could be really useful to people and could be organized into a very short, concise little webinar that might be fun, and at the same time I could perhaps introduce to you some Blue Poppy external topical formulas that you may have not used in the past. So that's what we're going to do today, is to talk about some specific treatments for different kinds of pain, old injuries of a chronic nature. Let me grab this little drawing tool here. And I'll give you just some stuff that I've collected over the years from here and there that I find to be useful for treating pain patients with or without scars, with or without all sorts of stuff, different kinds of pain, and we'll talk about those liniments. And maybe that's not going to work so well. Hold on one second. Okay, if I want to do this, I can't use the drawing pen. All right, so for pain due to old injuries or surgeries, consider scar therapy. Now, a tip from Stephen Birch, probably also Kiko Matsumoto, that when you're going to do scar therapy, whether you're going to use points on the scar or other points, check which direction you apply pressure. In other words, let's say you're applying pressure to gallbladder 34 for someone who had hip surgery and they have pain up in the gallbladder 29 or 30 area. So you're pushing on gallbladder 34 and you push down toward the foot, and does that relieve the pain? Or do you push from lateral to posterior, and does that help the pain? Or do you push from lateral to medial, and does that help the pain, etc.? And then that's the direction that you want to insert the needle, in the direction of the pressure that makes it better. And that's the same is true if you're actually doing pressure on the scar itself. In other words, if I press on this scar in this direction, does it improve your referred pain somewhere else or not? So needles in the direction that makes the pain better. And then with any old scars, irrespective of what else you do or don't do to them, I like to use either green willow liniment, which is for cold, damp, B with blood stasis, or dragon's blood, which is for blood stasis with blood stasis due to traumatic injury or to surgeries or things like that. The problem with dragon's blood is that both of them to some extent will stain, but dragon's blood will really stain. So you want to cover it with a gauze or do something to protect the person's clothing. And then over the top of whatever liniment I use, unless it's a liniment for some kind of heat, I want to use a Tiger Thermi warmer, especially over the length of the scar. You can use thread moxa, but I like the Tiger Thermi warmer better. It's gentle, it's calming, it feels good if used with aplomb and dexterity. It's a lovely tool to use along with liniments. And then you can also send people home with liniments, obviously. Patients with pain due to old injuries and surgeries continued. Let's talk about sciatica piriformis syndrome, back pain. Look around the tailbone or all over the sacrum for any vascular spiders. And if you find them, you really do need to bleed them if you want to get the right result. And when you do bleed, the lancets that I like best are the flat metal Medipoint lancets that you can buy either from Blue Poppy or from other sources as well. My preference is this kind of lancet. It's much easier to see exactly where you're going to insert it into the vein. And unlike the little plastic ones, which are very difficult to read, to use, and to see underneath, because they're not flat, and they're also not as sharp as the MediPoint lancets, so they cause more pain to the patient. More on old injuries and chronic pain. For one-sided low back pain, I like to use the red and black ion pumping cords, which again you can, I'm not sure whether Blue Poppy sells those, but I know that you can get them from OMS Medical Supply and probably from other distributors as well. We may even have them. I should know that, shouldn't I? But I don't. So anyway, black clip on bladder 23, or another way to say that is black clip on the most painful spot on the low back, right? So wherever it hurts worse. But if you believe that the kidney is involved, you may wish to use bladder 23. And then the red clip on a gallbladder point below, either gallbladder 29 or 34. I wouldn't rule out 35. I wouldn't even rule out gallbladder 41. I would try to find the one that was the most tender. And these are the ones that I find the most often tender, gallbladder 29 or 34. Try pressure on the same side as where the pain is. And then, press the painful spots and see if that made it better. If it did not, then switch to the unaffected side and see if pressing on those points affects the pain. And then that's where I would needle. With ion pumping cords, I like to leave them in place for at least 10 or 12 minutes, certainly no longer than 20. People get twitchy and uncomfortable, I think, if they're lying there too long with pumping cords. I follow this up with green willow liniment, especially if I believe there's some kidney insufficiency or vacuity involved. And then I like to use coupon moxabols or Bongray moxabols, depending on what you call them, exactly where the painful areas are. And you can buy all kinds of coupon or Bongray supplies from Blue Poppy. Surprise, surprise. More on chronic pain. Okay, if you have ion pumping cords with 3 colors, in other words, the green, red, black, I will use the eye of the knee point, both points. I will needle both points and then put the black clip on the one of those 2 points that's the most painful. In other words, if the lateral eye of the knee point is more painful, I'm going to put the black clip on the lateral. Then I'm going to go and find points that are, I'm going to go to the upper edge of the patella, Tutsun north or superior of that, on the lateral and medial sides of the thigh there, and I'm going to put the needles in there with the red clip on the lateral side and the green clip on the medial. Again, this is a Matsumoto and Stephen Birch style treatment from the great Japanese acupuncturist Yoshio Manaka, of whom Stephen Birch especially was a close disciple of his. And he was arguably one of the greatest acupuncturists of the 20th century. He died about 20 years ago. If you have only red and black clips, then put the black clips on both eyes of the knee and the red clips on both of those 2 points above the patella. And then if you have an extra set of cords, you might consider using pericardium red and spleen 4 black on the same side, ending with green willow plus either a Amoxis stick or a Tiger Thermi warmer on the painful area, especially if you believe that that person's pain is due to cold, damp B complicated by blood stasis, which we know that blood stasis is more and more likely the older the injury or the older the chronic pain is. For chronic joint pain, I highly suggest that you take a look at Blue Poppy's Impediment Magic. Impediment is Nigel Weissman's translation for the word bee. And if you look at the Chinese in this title, you will see that it has the word bee in it here. Bee, tong, ling, tong. Okay. For cold, damp bee with blood stasis in the vessels, and this is really a very useful formula to have on hand if you treat people with chronic pain. All right, let's talk about the MediPoint lancets again for a moment. With acute pain. With acute pain, I like to bleed ear points, unless there is also swelling and black and blue and, like a acute sprained ankle, then obviously you're going to bleed right there. But for acute pain, I like to bleed ear points because it's direct access to the brain and the nervous system. So I will look for any related point where there may be some discoloration or red areas in that area of the ear. You can also bleed ear shen mun if you don't know what else to bleed, if you can't find anything specific to bleed. If you think the person is stressed out, you can bleed the tip top of the ear as well. I know that's usually used for high blood pressure, but I think it also works well for any kind of chronic stress that's going to raise a person's blood pressure. And then I'll pick one of two liniments, either 3 angels if the area is hot and swollen, if it's still hot to the touch, or hot, swollen, and red. If it is not hot and there is no swelling, I prefer the stop pain tincture because you can use it with a TDP lamp or a hot pack or any kind of a heat, or with moxa. Okay, acute conditions continued. Again, referring to Matsumoto and Birch from a wonderful seminar I took with Stephen Birch a number of years ago, discussing plantar fasciitis, which, as you know, is difficult to treat. This is a tough one to treat. So here's this little protocol. In Matsumoto and Birch's book, they discuss the fact that plantar fasciitis may be related to old lung diseases or lung heat diseases or throat diseases or even chronic sinusitis. So if you can have that conversation with the patient and they say, yeah, I did. I had a number of years ago a really bad case of pneumonia or non-healing bronchitis or whatever it was, or a serious infection of some sort that affected the throat and lung. I'm going to start with stomach 2, and thank heavens they're not asking you to needle it directly through the foramen there, but transversely down. Then moving to large intestine 10, 11 area, checking for pressure pain, needling it if it is tender. In my case, I would needle it very deep, since those points are good points to needle deep, actually. Going on to stomach 44, if there has been chronic sinusitis, so in other words, both ends of the stomach channel, then take the palms of the hands and search for Osher points in the hands in the exact same place where the person's foot pain is. So in other words, looking at the hand as if it were a foot. So they say, oh, the pain is right in the middle, so you're looking between those two, the larger and smaller or greater and lesser thenar eminences. You're looking for painful points, and that's where you're going to stick needles. And then I'm going to go put stop pain tincture on the painful areas of the feet and send the person home with stop pain tincture. And, maybe an ear tack. In my case, I probably would use an ear tack. All right, acute ankle sprain, we know to bleed the worst point, and then needle the same spot where you bled on the opposite ankle as deeply as is comfortable for that patient, and then use this sprain ointment and wrap with gauze and then with an ACE bandage. This ointment is actually a famous ointment recipe. It's gooey stuff, so you're going to slather it on there and then cover it up and change the dressing every day. Wonderful liniment, or I'm sorry, wonderful ointment for sprains. All right, so people ask me this all the time when I'm teaching classes on pain management. What do I needle? What do I moxa? When do I use cups? When do I use heat? Etc., etc. So I wrote this. It might not come out exactly the same every time I would teach it, but basically this is my idea about protocols. So if there is an acute injury, whether or not the skin is broken, if the area is hot to the touch, painful to the touch, red, I am going to choose the relevant ear point and probably at least needle it, if not bleed it. And then I will find out, well, okay, if this is on, let's say, the foot yang ming stomach channel, I'm going to find the major points on that channel, the cleft point or she point, the source point, the most major channel point, obviously stomach 36, and any adjacent points that I can see. In other words, sometimes when there's swelling, you can't tell where the points are, but points that I can actually see them. In the area of the injury, I may needle those. I will probably bleed something. And if I use moxa at all, I won't use it if there's heat, but if it's swollen, I may use some mild indirect moxa, but that's the only kind I would consider using at that point. If the pain is acute, but there is no redness or heat or swelling, nor broken skin, I will needle, again, as above, a cleft point, a major channel point, a source point, any adjacent points I can get my hands on without causing the patient pain, and bleed an ear point or two. I might use moxa on those needles or indirect moxa. I will not put moxa straight on the skin at that point. If the tissue in the adjacent areas is thick enough, in other words, not bony, I might use some light cupping. I might use cups on, cups off, cups on, cups off with one of those plastic Korean sets where you're using a suction pump with it. That would be my choice. Bleeding, if there are other symptoms that suggest blood stasis, i.e. Spider nevi or varicosities in the local area. And then liniments, plasters, poultices, or soaks for the person to go home with. Third, if the pain is chronic, but it is not worsened by any particular type of weather, which is a shame because it's easier to treat if it is, but never mind. Direct moxa threads right on the area where the pain is, or if I don't do direct moxa, then indirect moxa with liniments right where the pain is, and needles on the contralateral side. In other words, the pain is in the shoulder, I'm going to do direct threads where the pain is around that rotator cuff, let's say, and then with needles on the opposite side, looking for channel points that are related. In other words, if there's pain at large intestine 15, I'm going to be looking at the stomach channel on the opposite leg for tender points between, let's say, stomach 35 to stomach 44, and find out where those points are that are tender and needle those. Maybe mild moving cupping or mild intermittent cupping to bring blood to the tissue to help it heal. Bleeding if there are other symptoms that suggest blood stasis, as I said above, and possibly a TDP lamp if that seems appropriate. Maybe some liquid moxa if I don't want to make smoke, or if the affected area is too close to the face and I don't want to get smoke in their face. So chronic pain or long-standing pain that is worsened by cold or damp, Then direct moxa using either kupun or bongre cups, or direct thread moxa right in the area, or a TDP lamp with liniments if I cannot make smoke. If you work in an office where you cannot make smoke, a TDP lamp is your friend with some kind of liniment so that you're getting some medicine in there. Or liquid moxa or stop pain tincture. All of those are possible choices. Again, bleeding if other symptoms suggest that there is blood stasis. And again, I would always use a liniment. I may send the patient home with ibuki or stick-on moxas. I'd like to actually cross out this stick moxa. I don't send people home with sticks anymore for legal and insurance purposes. But I would use ibukis if the person feels comfortable with that, and or liniments, plasters, soaks, or compresses. More on compresses at the end of this talk, actually. So what you need to know here is that in any kind of Chinese traumatology treatment, the use of externally applied medicinals is considered required for the best results, not just nice, but actually required for the best results, in addition to whatever it is that you're going to do internally that is appropriate for that patient. And I'm not going to go over internal formulas for trauma. All of you know probably several. In terms of Blue Poppy's liniments, there are plenty of other people's liniments too, but in terms of ours, I have them over here on the, grab this little highlighter, over here, the names of the ones that we sell, and then over here, the pattern and condition that these are used for specifically. To my knowledge, we are the only company that has a liniment that is for damp heat impediment, or B. Stop pain liniment is specifically designed to be used for if you're using a heat source like a TDP lamp, and dragon's blood is specifically for blood stasis. It is messy. If you're going to use blood, a dragon's blood, use some kind of gauze so you don't hurt or you don't cause any damage to a person's clothing. Okay, on to what's in some of our oils and ointments. Here we go back to sprain ointment, and what you can see is that we have an ingredient to clear heat. Oh, I didn't grab this highlighter. Whoops. I need to go back the other way. I'm sorry, technical difficulties. One moment, please. Okay, Da Huang for to clear heat. Zilan for maybe getting rid of the swelling. Dilong for moving the blood, as well as the Racina olibani ruchang and Racina oleanum ruchang to dispel blood stasis. Again, gardenia to clear heat and stop swelling. So this formula is for blood stasis and pain, and heat, and that's what this one does. It's a wonderful formula. Then this formula, if you look at this, what you will see here is that this is Posamon. This is our version of Posamon, except that it's a little cheaper. You can get it from us. You can get it from most of our distributors. We have some wonderful distributors, Crane and AccuMarket and Golden Needle and Camwo in New York and People's Herbs up in Portland. You can get it from all of those people as well as from us. The peppermint oil makes it aromatic and cooling. The cinnamon oil keeps it from being too cooling. The dragon's blood moves the blood. Scutellaria Huangqin clears heat. And Gansao makes it smell good and makes the other herbs, harmonizes the other herbs. So for muscle soreness and pain, I love to use this for cupping. I will actually mix it, if I'm going to do cupping, with the next formula, our sports massage oil. I love to mix Dr. Bob's with sports massage oil because it makes it a little smoother for cupping, or for gua sha, if you like to do that. This is a popular oil. It's sold largely to massage therapists, but if you do tuina or cupping or gua sha in your practice, you might like this oil since it is cooked. The herbs are cooked into it. So rushang and moyao for moving the blood, dingxiang, xiaohuishang, moving the qi, etc. So it's a lovely, nice smelling oil in an apricot oil base. It has a very nice smell to it as well. So what to try? What else to try if your treatments are not as effective as you would like? Akabani, some of you have been trained in Akabani, which is both a treatment and a diagnostic technique. So you may find out other things about what's going on with the person and treat those other things at the same time. Or if you have a Ryodoraku machine, it does the same sort of thing. There's other machines now available on the market, pretty expensive, but that do the same kind of thing of telling you what channels have more qi in them and what channels have less. Ear needles, tacks, or seeds to continue the therapy if you didn't already do that. If there are any purple black veins and you did not needle them, you did not bleed them, you really need to. If you haven't learned bleeding, you might consider some of my little videos and short courses. Important to learn how to do bleeding. It's such a powerful therapy, and if there are varicosities and you don't bleed, you won't get the result that you want, in my experience. Pay more attention to the root. In other words, go back to your diagnosis, and if this person's old injury or chronic pain is not getting better because their kidneys are weak, or their spleen is damp, or their lung qi is weak, or they have chronic heart fire or chronic blood insufficiency, any of those things can keep the body from healing. Remember that in the case of blood vacuity or deficiency, we know the statement in the Neijing that any tissue of the body cannot do its function if it is not nourished by blood. So if the blood is weak, we need ongoing, continuous supplementation and nourishment of the blood. 5, re-examine the patient. Go back over questions you asked, what the person's tongue and pulse is. Look at a book. Go back and check. What did you miss? What could you have done? What did you not see the first time through? Maybe you got it. Maybe it's right, and the person's karma is just not to heal through your care. But try again, with humility. Go back and look again. If you didn't teach them any self-care techniques, number 6, consider what they could be doing at home in between treatments. 7, find out what their work habits are, or if there's something about the ergonomics of their situation or what they're doing with their lives every day that could be better or different. Have you taught them anything about managing their stress? Could you give them a Qigong exercise? Could you give them a stress reduction audio tape, or we don't use an MP3 file for reducing stress, having them doing a specific stress reduction session. What are they eating? What dietary changes might support your root therapy? All these are things to try when you're not getting the results that you and your patient would like. So, in general, in all cases of pain and trauma, do not forget that patients need externally applied medicinals. 2, keep your treatments as close together as possible until the pain is staying away for, the maximum number of days that you can manage. Send the patient home with tools for self-care, whether those are exercises, whether those are diet, whether those are breathing exercises, whether those are, lying down and listening to Debussy in the dark, or whether it is a liniment, a plaster, an ointment, a cream, an internal herb, a compress, whatever it is. All right, so if you want to know more about a hot compress, here is an address for a little video that I did. You can go to Blue Poppy TCM TV and look up this YouTube video, or type in Honora's hot compress video, and that should come up on YouTube. It's at the Blue Poppy YouTube area. We have tons of other videos there too. I have demonstrated how I use bleeding lancets, etc. On how I do thread moxa, or how I bleed a jing point, that kind of stuff. It's all there at Blue Poppy's video area at YouTube. So thank you so much for joining me today. Watch for your email. There's a coupon that if you came to this live webinar, that you get that gives you some discounts on the products that I mentioned. So thank you very much. Good luck to you, and many blessings for success in your practice.